Good morning, everyone. It's Tuesday, May 5th. I'm Stephanie Haney here for 3 News. I've got your top headlines for you from WKYC.com and our WKYC app. We will start this morning like we do each day. I'll bring you the latest numbers from the Ohio Department of Health. These come out each day at 2 p.m. So these are the numbers that came out on Monday, May 4th at 2 p.m. from the Ohio Department of Health. This is where we stand right now in the state of Ohio with COVID-19 cases. We now have a total of 20,474 reported COVID-19 cases here in the state of Ohio. Remember, that's based on that expanded CDC definition that includes both confirmed positive cases and probable cases of COVID-19. And the number of deaths in Ohio is now 1,056. The total number of people who have been hospitalized so far is 3,809, and the number of people who have been admitted to the intensive care unit out of those people is 1,090. There is now a new White House model that projects an increased number of deaths by August related to COVID-19. We are just under 70,000 deaths now in the entire U.S. That's according to Johns Hopkins University data. So now that we are projecting 134,000 total by August, this is double a previous prediction from last week of 72,000 deaths by August, which we are coming up on very quickly here. So I think we can see why that model was updated. Now, in the past, several weeks ago, the Trump administration did project anywhere from 120,000 to 240,000 deaths. So now, according to this new model, a total of 134,000 deaths projected by August. This is due in part to rising movement in most states and the pulling back on some of those physical distancing measures that have been so extreme in the recent weeks. One specialist did comment on warmer weather. There was some conversation from people related to COVID-19 about warmer weather potentially impacting the spread of COVID-19. And one specialist said that while warmer weather would be important, that person thought that it would be minimal in terms of impact of the transmission of COVID-19 here in the U.S. On March 31st, Dr. Deborah Birx said during a White House coronavirus task force press briefing that they had been relying on the University of Washington model, and at that time, as we mentioned earlier, was when it was projected anywhere from the 100,000 to 240,000 deaths if the U.S. maintained those safe distancing protocols. The Trump administration is now blocking the entire coronavirus task force from testifying in certain ways on Capitol Hill. This is based on a White House memo to congressional committees that says no member of the administration's coronavirus task force can agree to testify on Capitol Hill unless the invitation is expressly approved by the president's chief of staff. The memo follows a recent White House move to block Dr. Anthony Fauci, the nation's top infectious disease expert, from testifying before a House panel. Now, as a reminder, the House of Representatives is controlled by a majority of Democrats at this time. However, Fauci is allowed to appear the following week at a Senate hearing, which is controlled by Republicans. The memo was obtained by the Associated Press and also seeks to limit the number of coronavirus-related appearances on Capitol Hill for those in key departments that are responding to the pandemic. According to the memo, obtained again by the Associated Press, it states that the demands on agencies' staff and resources are extraordinary in this current crisis. There is now a new study that shows that Americans oppose reopening the country too quickly. This is out of Washington Port University of Maryland, this poll. And the poll shows that Americans are concerned about opening specifically restaurants, stores, and other businesses. The poll said that most people, 82%, were against reopening movie theaters, 79% oppose reopening gyms and fitness facilities, 74% oppose reopening dine-in restaurants and nail salons. Right now, several states are starting to lift restrictions that help prevent the spread of COVID-19. That includes Ohio, as office settings were able to return to work, generally speaking, on Monday. Governor Mike DeWine also said that retail locations could offer in-store appointment sessions over the weekend, and also said recently that we can expect restaurant information reopening to come soon. So Ohio would be counted among those states who are now lifting restrictions. We were one of the first states to put in place restrictions, also one of the first states to ease back on those restrictions. So this poll was conducted between April 28th and May 3rd, and it was interviews of 1,005 random adults. That's according to the Washington Post. Here in Northeast Ohio, the University of Akron is now announcing plans to reduce college and athletics budget in order to save money because of the impact COVID-19 has had on the university. University of Akron President Gary L. Miller said on Facebook, "As you know, all university revenue sources have been significantly diminished by the pandemic. Many people talking about college athletics and how that's a huge source of income for institutions of higher education." Miller didn't mention specific plans, but he gave an idea about what's to come at the University of Akron, mentioning significantly reducing the athletic budgets, and more information to come on that in the next week or so, but also reorganizing and staffing of the university's operations of a 5-college model. This is what he said. He said, "I called for a dramatic reduction in the number of colleges in order to reduce administrative costs, match long-standing enrollment trends, and build on our strength." So one question that people are asking is whether college will be eliminated or condensed. That makes a difference in terms of the administration and how they'll handle those things and what the names of those colleges will be, if certain areas of education will no longer be available at the University of Akron, or if they'll just be folded in to other areas in order to streamline the administrative, the record keeping, the bureaucratic aspects of the university. So that's a question that people are still asking, and we will be following and hopefully get answers to that soon. University of Akron is not the first school to face difficult decisions like this. Kent State announced last week plans to cut their budget by 20%, as well as cities also slashing their budgets. There's a lot of budget cutting going on right now as people work to sort of fill the gaps with revenue that's been lost because of people doing what the experts are telling them to do, staying at home to stop the spread of COVID-19. Here's some exciting news for people this week in Northeast Ohio. The 180th Fighter Wing will be conducting flybys in the state to honor essential workers. This is the Ohio Air National Guard's 180th Fighter Wing. They will be doing the flybys this week. This is an effort to salute the heroes at the forefront in the fight against COVID-19. That includes Ohio healthcare workers, first responders, military members, and other essential personnel. And this is their small way of thanking people for keeping Ohio safe. And it's also an effort to lift the spirits and morale of Ohioans here, so you can look up in the sky and see that testament to the hard work that everyone is doing, including everyone who is staying at home in order to keep other people safe. So here's what we know so far about the schedule. Tomorrow, May 6th, we can expect that flyby between 1:45 and 2:15 p.m. in Toledo, Napoleon, Defiance, Archbold, Wauseon, Delta, and Swanton. And then May 7th, on Thursday, we can expect that in the morning in Cincinnati between 10:30 and 11 a.m. In the afternoon, again between 1:45 and 2:05 or so in Lima, Findlay, and Bowling Green. And then from 2 to 2:15, Sandusky and Fremont. And then from 2:15 to 2:20, Dayton, Wright-Patterson Air Force Base, Springfield, and Springfield ANGB. So you can find that schedule as well on WKYC.com, and there will be more exact times listed once those are known. So again, check WKYC.com and our WKYC app for that. And of course, we can't talk this morning about May 5th without talking about Cinco de Mayo. Happy Cinco de Mayo, everybody. As a reminder, a little bit of history here. Cinco de Mayo celebrates the Mexican Army's victory over the French Empire at the Battle of Puebla. That was on May 5th, 1862. This is not Mexico's Independence Day. A lot of people get that mixed up. Mexico's Independence Day is September 16th, and what that celebrates is the day that a church bell rang, and that was in 1810, kicking off the start of Mexico's War of Independence from Spain. So that's not today. That's September 16th. We can all celebrate that day as well, but that's not today. Today is Cinco de Mayo, and what we like to do to celebrate Cinco de Mayo is enjoy Mexican cuisine. Of course, you can't go to your favorite local Mexican restaurant, so there is something that you can do. BARRIO food trucks will be out and about in Northeast Ohio offering curbside pickup of their taco kits. The kit's $25. It includes chips, guac, salsa, toppings like chicken, cheese, and other taco fillings. And they're also offering a $10 appetizer add-on. Some locations where you can find that are Great Northern Mall's parking lot and the Bedford Winking Lizard parking lot. We have more information on that on WKYC.com. So if you are able, today's a great day to support local. Everybody is missing BARRIO. I know that for sure. I know my family really loves BARRIO, and they love it any chance they can get. So today is an opportunity to do that because the stores are not all open. Okay, those are your top headlines for this morning from WKYC.com and our WKYC app. Next up, we have 3 News Connect. That's with Jay Crawford and senior health correspondent Monica Robbins. That's at noon on TV on 3 News, also on WKYC.com and our WKYC app, as well as Facebook and YouTube. I will be back here at 2 p.m. with our updated numbers from the Ohio Department of Health and the rest of the top headlines from our site and our app. I will see you back here in a couple of hours. I'm Stephanie Haney.